In the meantime, while we wait for Dr. Paul, would you like to do a roll call just to see who we have on the line?
Hi, it's Nelson Zandbergen from Nation Valley News.
Nick Seabrook, Cornwall Seaway News.
Bill Kingston, Cornwall News Watch.
James Morgan, The Review, Van Cleek Hills.
Philip Blanchard, Morrisburg Leader.
Ayub Sila, Upton News.
Hi, everyone. Dr. Paul here.
Hello, Doctor.
Hi.
Hello.
Hi, Doctor.
How's it going? Gee.
Good.
I hope you guys having a better day than I am. Anyway.
Oh dear.
No,
Yeah.
it's just a wall-to-wall calls and wall-to-wall emails and all these things going on. So anyway, so let's get going. I'll give you a bit of an update, and I got some questions here that I've received. So we'll get going with that. Bonjour tout le monde, on va commencer. Just to give you a bit of an update, we're status quo in terms of numbers. I know that a lot of you have questioned where they are and how many we have and why we're not giving more details. It's just that we're so busy and really trying to focus on some of the messaging for self-isolating that, I don't think it's relevant where they are. If it's Prescott Russell or SDNG, doesn't really matter. I think the point is that we want to know what is in our area. Out of the four that we've had, one we're not sure of travel. The other three we had travel. So I'm presuming that it's in our area, and that's why I'm very much focused on making sure we get the messaging out for self-isolation and so on. So in terms of some of the other updates that are going on, again, we'll just keep monitoring. We've had, I have my notes here that I wanted to make sure I covered everything. As you know, the ministry has now extended some of the orders as of midnight today to close all non-essential businesses and workplaces. And there's a long list of exemptions in there. One of which I will address, which is the daycares later on. As you know, there is an emergency declaration provincially. I've got a call, and there's a question about emergency declaration with the municipalities. We are in discussion with them because apparently there are some advantages that municipalities may get or additional powers that they would get and sort of levers and abilities to maneuver quickly with enacting that, and that's going to be discussed with each of the municipalities moving forward. I think that one of our biggest challenges was, again, the self-isolation issue. I think I want to be clear that if you go to the healthcanada.ca website, there's very clear kind of indications of what you should be doing. So individuals should, stay home, monitor the symptoms. They should avoid contact with other people, obviously limiting contact with others. They can, while they're home, obviously, stay away from others. They can walk around their home. They can walk around their property, but however, they can't be closer than 2 meters away from anybody else. They have to be distancing themselves. Obviously, our message, and I think I said that yesterday, and we did a press release after our call yesterday afternoon, is do not go to the mall. Do not go where people are crowded. You can walk around, and that's it. Now, this only applies to people who have no symptoms. If you have symptoms, you stay home, and that's for sure. People have asked me. I was just on a call with the municipalities, and municipalities are getting multiple calls about people seeing. The guy was in Florida a couple of days ago. Now he's in Walmart. That shouldn't be happening, obviously. And I think that as these things occur more and more, there's going to be more stricter, abilities with police enforcement as we move forward. So I think again, our message is. So if you see somebody that who's outside of his house, who's come back recently from outside of the country, just walking around the house within that area, that's fine. If you see the person in the mall, if you see the person at the pharmacy, that's not fine. So I think I wanted to get that message out, and that's one of the questions that I got here today. Finally, the other thing that I wanted to talk about really was with the additional emergency order. And by the way, as you know, they've extended the school closings to April now. So that's another thing. It's not going to be closed just for the next 2 weeks. It'll go beyond that. Again, part of our social distancing and sort of public health measures that we're doing and are being expanded. One of the things that I wanted to talk about was daycares, and as you know, the initial order from the government, from the provincial declaration of emergency, was that in fact licensed daycares should be closed. I extended it on Sunday to include all daycares because I truly believe that if you have a daycare with a lot of kids in it, whether you're private or licensed or not, kids can have very low symptoms. They can mild symptoms, and they, as other infections, are real good at distributing it to their parents and grandparents. So that was one of the reasons I wanted all daycares to be closed. And so now there are two little changes in that. One, the government, and I see where they're coming from, has now requested that there's be the establishment of or opening of certain daycares, but exclusively for frontline essential workers, primarily healthcare providers, so they'll have a place where the kids can be taken care of while they're working. So I see that. There's going to be some parameters set to that in terms of how you monitor the kids, how kids are spaced in there, making sure that the sick kids don't get in, those type of things. And then yesterday, if you notice the list of the exemptions, which is about 85 exemptions on that list, one of the last ones was private daycares exempt from this, closure of workplaces, with kids with less than 6 children. So what we're going to be doing is I will exempt those as well. A press release is being prepared right now, and we're advising those private ones that, however, the caveat is that if you have less than 6 kids, but you need to be following certain precautions, there are certain directions that we're going to be giving them in terms of how kids are going to be spaced, testing, screening the kids actively, and all the precautions have to be in place. And so those, provided that they adhere to the strict infection control precautions that we will be directing them, are exempt from my order. But I want to make it clear that others are not. So my order continues for all licensed and non-licensed daycares, except for those that are going to be designated for healthcare workers' kids, which we will be working with the owners and premises to ensure that they instill the appropriate infection control mechanisms, and B, those private daycares that are only have less than 6 kids and adhere to the infection control precautions. So I just wanted to make that very clear to everybody that indeed we will be doing that in response to some of these changes. So I'm just going to go to some questions here. I got another one is about the information about the cases. We're putting out the cases on our website right now. I have daily media updates, and I'll be very happy to answer any specifics that I can about the cases. But one of the things that I got asked about was our capacity to answer phones and staffing, because apparently people said that it took a long time to answer. So I just want to say that at this point we've deployed a lot of our nurses. We usually have 2 or 3 nurses answering our phones. We have 14 nurses now working 8 to 8, 7 days a week, answering up to 400 calls a day. And for the last couple of days, we've been getting between 250 and 300, and we've actually responded to them by the end of the day. We can't take them all simultaneously, but we do respond to them. So it's a tremendous number. We usually get 20, 30, 40 calls, going up to 400, sometimes 450 calls a day. Like I said, yesterday it was about 250. And a lot of the calls, I must say, are about people complaining about seeing their neighbor walk at Walmart, and he or she just came back from outside of the country. So those are the numbers. And finally, the other one, again, I think I answered it, but the other one was, have we advised the municipalities on declaring a state of emergency? Well, the state of emergency can be declared by the city and by the medical officer of health. At this point, we have spoken to some of the municipalities about it. They've looked at it with their legal counsel in terms of what the advantages are, and we're going to play it by ear on a day-by-day basis in terms of is it time and is it appropriate for an individual municipality to declare a state of emergency, given that there's already a provincial one. So they're trying to measure that against the situation at this point. Finally, I want to just say one more thing about our assessment centers. The Hawkesbury Centre opened yesterday. There were approximately 70 people that came in. Not all got tested. It went very well. It's a place that is a former clinic, so it was really like a clinical operation. It's continuing to go that way. We're now working with our Cornwall site, which is going to be likely online by the end of this week, and we're looking at and our Winchester site is almost ready as well. And as we move forward, we're also looking at our Castleman backup, our Alexandria, again, ready to go when the trigger is there. And how they'll be actioned really has to do with the number of patients that are overwhelming the emergency room. We're not at that stage at this point in time, aside from the usual numbers of, cases that they're seeing. Maybe they're getting a couple of more, but we're keeping a very close eye on that. And like I said before, these centers will be primarily for testing as they open up. But as things progress and we get more cases and more embedding of the virus in our area, which we hope to minimize, that's our goal, we will then be switching to a mode where we'll be assuming people have it if they're sick, and at that point we will be offering those assessment centers to actually be medical assessment centers where individuals can go if they're worried about their symptoms. Like I said, I've said it time and time again, most individuals, 85-90% of the individuals, depending on the age group, will have minimal symptoms or mild symptoms or mild enough to stay home, not require hospitalization or emergency treatment. But I do understand there's a lot of people that are worried with all that's going on worldwide that they'd be worried and want to get evaluated. So, if they don't have any emergency symptoms, shortness of breath, turning blue, fainting, those type of things, we'll have these assessment centers available for them so they can not visit the emergency room, but at the same time, perhaps give them a reassurance they don't need to go to the emergency room. So that's, I just wanted to say that, and I can't give you any timelines on where they're going to open. It's just a matter of looking at, again, the pattern of infections in our area, the sources of infection in our area, and the number of patients in the emergency room, looking at their surge and looking at the capacity of the emergency room. So that's it for my sort of spiel. If you have any questions, I'll take a couple.
Hi.
I have a question.
I just wanted to ask
Go ahead.
the city of Cornwall. The city of Cornwall announced today that they're closing all their play units and posting them that people shouldn't be on them because they can't do infection control. What are your thoughts on that? Prudent measure?
I think it's a very prudent measure. I think it's very hard to clean out. These viruses can last on surfaces for up to a couple of days. And the thing is, we don't want people to congregate either. So play dates and those type of things are out, and I agree with that.
And just
hello?
Yes, I have one more call from Bill, and then I have somebody else saying here. So go ahead, Bill.
Right, one follow-up is also about people congregating. Now that the weather's getting warmer, chip trucks are coming online. Just their inherent nature has people lining up and coming in close proximity to each other. I know those are probably covered under restaurants that offer takeout. And what are your thoughts about that whole atmosphere?
Yeah, that's a very good point, Bill. I haven't really thought about that, but that is a possibility. I mean, there's ways of doing it. There's ways of distancing yourself. Individuals can have glasses and serve as well, because they're not dine-in, they're takeout. So at this point, what I would say is that provided that they have certain mechanisms in place, i.e., for example, you could take one person at a time waiting, or call ahead for your order, or something like that. There are ways that you can go around it, but certainly you're right. You don't want them lining up one behind the other to serve. So there's two ways. One, you can, like I said, put a glass compartment protecting the individual from inside, but then you can sort of look at control. Perhaps people can drive through it, those type of things. So yes, you're right. That is a good consideration. I'll be speaking to my public health inspectors and our food manager for that. That's a good one, Bill. Thanks.
I'm also thinking about the actual containers as well. People grab the ketchup and salt and whatnot.
Yeah, all those things will have to be appropriately looked at. Okay, I got another call from somebody screaming at me. Go ahead.
Well, that's me. It's Leanne Lawrence from LifeSite News. I sent an email, actually.
Yeah.
It's a little bit of a different perspective, and it's regarding the closing of churches.
Yes.
Archbishop Prendergast said that they've closed the churches now. You may or may not know that the Catholic Church, we believe that Jesus is present in the Blessed Sacrament. It's very consoling for us to be able to go into the church for a private prayer in front of the Blessed Sacrament. My question is, why would liquor stores and pot stores be open when Catholics are not allowed the consolation of, if they follow protocol, only fewer than 10 people in the church? Why wouldn't the churches be allowed to remain open if they are able to ensure those sorts of safeguards?
Well, first of all, I don't have any say about the licensed LCBOs and the marijuana stores, and I agree with the comparison. I agree with the comparison, but let me talk about the churches and mosques as well. You can have 10 individuals, but 10. It's hard to control. My theory is that it's hard to control the number of people going in. Number one. Number two, it's also hard to control the age of the people going in, and you don't want to put the vulnerable people there. I do understand and respect the religious approach, but I have to take a stand on these issues, and they have nothing to do with being anti-religious or anything like that. I'm looking at the public good here.
Well, then would you agree then that the liquor stores and the cannabis stores should be closed as well? Because it looks kind of
inherently, I'll be honest with you. Inherently, I was surprised that they were there, but I heard that, and I have to tell you that today at the premier got skewered on this. They were asking this during his press conference, and he said that he had consulted and he was actually compelled by mental health experts that it would be sort of disastrous to close them down because of the number of addicted people. So that's his response from the point of view of retail stores selling, essential products. Is liquor an essential product? I don't think so. I don't drink. But I can see the dichotomy there. I see the irony. Next question, please.
James Morgan from the Review here.
Yes, James.
You mentioned that they saw approximately 70 people at the Hawkesbury facility yesterday, and not all of them were tested. Can you tell me how many were tested?
I don't about 45 were tested, 39 were not, something like 29 were not, something like that, yeah.
Okay, that's good.
Okay.
Thank you.
Thank you.
You Brooklyn News, Dr. Paul. I have a question in French.
Le français, oui, allez-y.
Oui, alors je voudrais juste vous poser une question par rapport à une molécule, en fait, on parle beaucoup de cette molécule dernièrement. Qu'en dit le bureau de l'utilisation de la molécule hydroxychloroquine et l'azithromycine comme remède à la COVID-19? Est-ce que le bureau aujourd'hui recommande, est-ce que aussi les autorités sanitaires en Ontario recommandent ce genre de molécules?
No, c'est parce que ces molécules sont. I'll say it in English after for my English counterparts, but ces molécules chloroquinone, c'est une maladie, c'est un médicament avec beaucoup d'effets secondaires qu'on n'a pas assez encore des données scientifiques pour dire oui, allez-y avec ce type de traitement. C'est pas la première fois que j'ai reçu cette question. The question was hydrochloroquinones, which are anti-malarial drugs. Have they been effective? And there's some studies that show that maybe they're effective, but some others show that they have a very high side effect profile. So at this point, they're really not recommended. I wish they were, because that would be something to treat, but they're not recommended. I'll take one more and then I'll stop, please.
Dr. Paul, Seabrook Seaway News. I was wondering, where is the Cornwall site going to be located? If you plan to have it open by the end of the week, you must have a location.
We're initially going to have. We're finalizing it. It will make an announcement tomorrow because we're looking at two places and we're just going to see which is the better one. So I don't want to give people the wrong idea.
Okay.
Okay, but we're good to go once we find it. It's quite quick to implement it, so I'm not worried. Anyway, thank you very much, everybody. Merci beaucoup tout le monde. Bye bye.
Thank you, Doctor. Bye.
Thank you.